All right, Clean Freaks, welcome back. We are with Malinda Elammari, our sterile packaging expert here at Beyond Clean. You know her as the Packaging Princess. She's the clinical educator specialist at Healthmark Industries at Getinge Company. Malinda, welcome back to the show today.
Yay, thank you. Thank you very much.
And you got your crown. You're owning that princess piece. I love
do.
that.
Representing crownies.
That's right. Yeah, you're well known. You set the trend out there a couple of years ago, and those crownies just continue to grow over time.
I know,
It's like
it's
every
amazing
year
seeing
they
it.
show up. Yeah,
Yep.
yeah, it's really
I
cool.
love it.
So on today's episode, we're going to be talking about the arch nemesis of certain kinds of packaging. And I guess, rigid containers a little bit different, but they can still get what we're about to talk about in certain places. And we're talking about holes. So let's just start off, real softball. What's the big deal with the hole in packaging?
Yeah, so once a packaging gets a hole, so your packaging, in this sense, what we're talking about is a sterile barrier system packaging, right? And this is not just like protective packaging. So when we talk about a sterile barrier system packaging, this is a packaging that creates a sterile barrier around a product, making it safe to use for a patient for surgery. So once we get a hole in a package, there goes our sterile barrier, right? That compromises the sterility of the package. And so that can create a whole bunch of issues with microorganisms getting inside the packages and stuff. And so things that you don't see, those little bugs and stuff, those tiny little guys, those creepy crawlers that get inside there. So, and that compromises the sterility. So it's a huge problem. It's a huge problem for patients' safety. So we want to make sure keeping the patient safe. Holes is definitely a no-no. Yeah.
And we're saying holes, but really like we're including, tears, rips, scratches, abrasions, anything to your point that's opening up that pathway for those bugs to enter into the device or to the package. And clearly like that can happen a lot of different ways, but can you outline maybe some of the more common, well-known contributors to these holes, rips, tears, abrasions?
Yeah, well, it's sterile processing. We sit downstairs and we poke holes in wraps and
Right?
stuff,
Yeah.
because, hey, why not? We got nothing else better to do than do the same tray over and over again, right? Like, well, I
That's a
guess.
joke, just in case
Yes,
anyone.
it's a joke. I'm joking. I'm joking. Good. Yeah, good call. Don't make sure that everybody knows I'm joking. So there's so many factors that cause holes, right? It's stacking. The storage of trays can cause holes. The weight of the trays can cause holes. Loose instruments inside the trays can cause holes. The handling is a huge one that can cause holes, as far as how do you take it off the storage shelf? Are you doing the proper technique of lifting, putting your arm underneath, lifting the tray up and taking it off? Or are you just like kind of snag dragging it off of the shelf? That can cause holes by doing it improperly. And I joked about SPD being the one who puts holes in it because we, for some reason, we seem to get the blunt end of that blame game, right? When, to your point, there's so many factors, there's so many people who touch that tray and who can contribute to get the tray getting holes in it. So, when we see trays with holes and we're in facilities, we really need to do like an analysis of where, at what point are the holes happening? Try to hone it down and do a study, watch how people are handling those trays. And it's not just sterile processing. Like I said, it's the operating room nurses, the surgical techs, even the vendors, the reps that come in themselves. They are sometimes the biggest contributors. Sometimes I walk through the halls and I see, a big cart of stacked wrap trays, and that's okay, issue number one. The other issue too is on that cart, the cart that they're stacked on, it's way too narrow for the length of those trays. And that hanging off the edge puts pressure on those wraps and that trays, and you can get pressure cuts into those trays, into those wraps. And then, on addition, you see the vendors just like kneeling over on the wraps and just having a conversation, and they're just having a chat and stuff. So, another contributing factor, and I mean, I say vendors, and I'm just using them, but you see it, nurses do it, surgical techs, they don't understand the concept behind it. So, really educating them around that. But it's just so many factors that can contribute to holes. So, if you're in a facility that has that, I think it's definitely a metrics that needs to be tracked so that you can do a process analysis and, understand better and try and hone down and get rid of the situation that's causing it. But I don't think it's not a metrics that should be counted against as an error concept, right? Because you don't know at what point or where the holes came from.
Yeah, yeah. To your point, those assessments or those analysis that you described, those are critical to get your arms around the factors that we just described. Like, what are the contributing factors in our process? Because all these department layouts are different, the transport processes are different, who has access to the trays many times are different. So until you have the opportunity to do that internal assessment, it's very difficult to start checking off and creating that education that you alluded to. Even if there's someone that's going to be touching our trays, have they been trained on the proper care and handling, regardless of what department they're a part of? If they're touching your sterile processing trays, there needs to be some level of accountability and competency created there. So if anyone's tuning in and has a question about that process analysis that Malinda mentioned, we're going to have her contact info in the show notes for this episode. Please reach out to her. She can point you in the right direction, might even have some other resources to share on this. Ton of experience in departments that have gone through this journey of trying to solve the whole challenge. But that's going to do it for this episode. Malinda, I got a feeling that we're going to see you again a couple times here, right?
I hope so.
All right.
I
All
got a
right.
lot more to say, Hank.
That's great. On the next episode, we're going to talk about another one of those hot topics in packaging, the package within the package, the double pill packing, or even maybe some things that aren't even as compliant as that. So hang with us, and we'll talk to you again on the next episode of this Sterile Packaging Expert series with Malinda Elammari.